Okay, welcome everyone. I know people will be coming in um, as we go here. Um, and we're going to get started to be sensitive to everyone's time. Hello, I am Wendy Singer. I'm Director of Programming for an amazing nonprofit called No Shame on You. On behalf of our volunteers, staff, board of directors, we welcome you to today's program, part of No Shame on You's monthly Feed Your Mind lunchtime series. On the menu today is What's the Deal with Adult ADHD? An overview and research supported tools for thriving. Founded in 2014, No Shame on You is dedicated to eliminating the stigma associated with mental health conditions so the people who need help will seek it and family and friends will know how to provide proper support and to save lives. We achieve our missions through programming like this today, educational presentations and workshops to organizations, schools, parent groups, companies, etc., daily online tools and resources. We have a social media following of close to 125,000 blogs, podcasts, and more. Today's presentation is in partnership with another equally as incredible organization, Children and Adults with Attention Deficit Hyperactivity Disorder, also known as CHADD, CHADD. Today, the presentation will be by Dr. Laura Knouse, who serves on the Professional Advisory Board of CHADD. She is also a clinical psychologist and professor of psychology at the University of Richmond. Her research and clinical expertise focus on the nature, assessment, and treatment of ADHD in adults, specializing in cognitive behavioral therapy, CBT, for adults with ADHD. Her recent, hold on, I'm going to let in a few people. Please forgive me. Something popped up. Her recent research aims to better understand the self-regulation and motivation difficulties of college students with ADHD in order to develop effective interventions. And now for just a little bit of housekeeping, we ask that you keep your microphone on mute. We will have an audience Q&A after the presentation. You can submit questions to me at any time, Wendy at No Shame on You, throughout the presentation. And there will be some times that we can pick up some questions in between. And without further ado, thank you so much, Dr. Laura Knouse.
Thank you, Wendy. And I couldn't agree more about the ways that our organization's missions and interests overlap. And as a representative of CHADD, I'm just really grateful for the opportunity to partner with you all and to talk to everyone who's on the call today. I know time is valuable, so I really appreciate it. So I'm Laura Knouse. Thank you, Wendy, for the introduction. And Wendy shared some great information about me. My work over the past 20 years, from when I started in graduate school, has been in adult ADHD. I think I have a little bit of an interesting, somewhat historical perspective. I wrote about in an article recently that my first encounter with a person with ADHD, or at the time ADD, or hyperactivity, was one of my pals in first grade who at lunchtime would go to the nurse to get his medication. It's just amazing to see how the treatment of ADHD has changed, the way we conceptualize ADHD has changed, who can access treatments. Of course, we need to still work on that. But I love the title of this, What's the Deal with Adult ADHD? Because as researchers, we're still working on that. You know, it's really evolving. Another thing that's evolving is some of my outreach work. So this is, for me, a new talk where I'm bringing together some material that I use in my treatment work with college students with ADHD and some other informational talks that I've given. But I'm really excited to pull this material together. So just know that I'm happy and open to feedback. And as Wendy mentioned, I'm happy to hear your questions as we go along. Like, I really like that idea of give me your just-in-time questions so that I can address them. And of course, we'll have time at the end for questions. So I'm going to go ahead and share two things. So the first thing I'm going to share, this is a link to an article that I wrote for a wonderful publication called The Conversation. I recommend it to you if you have not heard of it. It's basically an online site that invites academics to write more accessible articles about their work. And so if you don't want to furiously take notes and you want a summary of some of the things I've talked about today, that article really summarizes a lot of the kind of developments and research on adult ADHD. And then at the end, I'll also share some of my like favorite resources for if you're an adult with ADHD or if you have kids with ADHD, sort of like what are my best and brightest there in terms of other resources. I'm going to go ahead and share my screen. And also my second screen that I'm using is positioned slightly above my laptop. So if you see me sort of glancing up, that's kind of what's going on there, but I try to maintain some eye contact here. All right, so let's get into it, I guess. Before I get started, just a couple of disclaimers. So I do, just in terms of sort of understanding what I do and who I work with, I'm employed at the University of Richmond. I also do receive book royalties from Taylor and Francis Publishers. And I do consult for an app company called Inflow that has developed a CBT-based app for adults with ADHD, just so you know that if I mention those things, I do have a vested interest there. All right, so yeah, at first I just like to know I'm a clinician at heart, right? So I want to jump in with assessment in some ways and get to know a little bit about like who's joining us. And I guess by that I mean like, if you're willing, just kind of throw in the chat, like what, are you a person seeking just information? Are you a parent? Are you a person with ADHD? Just anything you might want to share there about like who you are and why you're here, just so I can get an idea of who's in the room. Of course, this is totally, up to your comfort level of sharing. But if you'd like to throw anything in there, I'd be curious about it. Let me get my chat.
And I'll read the chat, but I'll start with myself. And
cool.
That's simply that I've always been concerned that I have some attention challenges, and so I think I'm just looking forward to hearing everything that you have to say and maybe some tips and tools that will help me, even though I don't have a diagnosis.
Awesome. And I would say one thing that I love about, just to interject about that I love, I think I shared this with Wendy before. One thing I love about doing this work and the sort of cognitive behavioral skills is that no matter who you are, any of us can work on our skills in making our important goals into actions. So this is the kind of stuff that could help anyone. It doesn't mean that it's not harder for people with ADHD, but it's something that just, I think, generically can make our lives better. So I like this work.
Okay,
awesome. So
we got
go
a
ahead,
couple
Wendy.
things. Someone just seeking to learn more. Someone came on who manages someone who has ADHD and has become more open about their diagnosis, how it affects their work, and how I can support them. Rebecca, it's good to see you. We have a parent of an older child with ADHD and another parent who suspect that both my child and myself have it.
Awesome.
Thank you for sharing, everyone.
Yeah, absolutely. And just, kudos to the people who, wherever you're at on your learning journey, like the people in your lives, whether that's you or others, like are very fortunate to have you, wanting to educate yourself and learn more. Can I just check, are you all seeing the slide with the hands raised that says who's joining us today? Okay, just checking because I have it's been a while since I taught over Zoom, so I'm like a little paranoid about the slides. But
You're
anyway,
doing great.
Awesome. Okay. So I am just going to start in with some background. But first, I love to kick off the conversation this way because like ADHD is rarely a topic that people come completely to the table with as blank slates, to mix two metaphors. So I sometimes like to just see, what questions there might be. And some of them we could talk about now, or I'll say, okay, we're going to get to that in the talk. But I'm curious if you're willing to share in the chat, anyone who's willing to share, what's at least one thing that you have heard about ADHD and you're not sure is true, or maybe like you're pretty sure it's not true and it's like your pet peeve, like what people say about ADHD, or anything you have brought today where you're just kind of like, yeah, I don't know about that. maybe you'll have like 1 minute just to think about that and throw those in the chat if you have a thought.
One thing I think about as people are thinking is just if you, is it possible, I also not only am concerned about my own self, but I have a daughter with ADHD and, is it a myth or truth that people who present with it as kids can grow out of it?
That's one where I will say, and I can address, yeah, this is, and it's so interesting because in the olden times, by which I mean like the 80s, which is not really the olden times, but it feels like it. I think the thinking was, yeah, most boys who have this, because let's be honest, that was the kind of prototype at the time. It is a childhood limited thing. But of course, as we've learned how better to measure ADHD in adults and we've followed people over time, we do find that some people do persist in having ADHD, but we do have this group, to your point, who does appear to, I don't want to say recover, that's not the way that who does appear in adulthood to not meet criteria for the disorder, let's put it that way. And the longitudinal studies suggest, this is very rough, but suggest that there's about a third of kids who will continue to meet full criteria in adulthood, meaning they're, showing impairments to that level. We would say they meet the diagnostic criteria. A third that like may have milder symptoms, but are still experiencing impact. And maybe like a third that no longer appear to meet the criteria. So, and what's so interesting about it is that I have not seen any research that's been able to identify what predicts who's going to grow out of it, even including the neuroimaging studies. And we really don't know who is in that group and why at this point. But on the other hand, we do know that even people who retain symptoms can learn some of these strategies to better manage the ADHD. But that's a great question because I wonder that myself. Yeah, any other?
I had another one that came into me privately,
Okay.
and that question was, which I think I think I know your answer, but I'm gonna let you answer that, of course, is if you have ADHD and you have used medication for it, is there any chance that you cannot take medication and work it out that way?
Yeah, I mean, so there is there's a lot of nuance there, right? To like, Wendy, you're probably alluding to my tool in the toolbox metaphor. There's sort of like what is most effective for a given person can vary over time. It can vary between people. It depends on what the demands are in your life. It depends on sort of a lot of things. So I think that's a great question. And I might sort of punt that a little bit because I am going to talk about medication and therapy and what we know about them and how they can work together. Yeah, I think that there are times when people think about medication and therapy as in opposition or in competition with each other. As a person who uses, to full disclosure, I'm a clinical psychologist, not a psychiatrist, so I don't prescribe medication. When I talk about medication, they're going to be generic things we know from the research literature, not from me as a practicing clinician. But I think there can tend to be this idea of like moral superiority of one type of treatment over the other, like skills are better than pills. And it's like, well, skills are different than pills and both can be helpful for different people at different times. And so I just take a very pragmatic and individualized approach to, and lifestyle factors, other things that can be part of the suite of things that's going to help you. Yeah. So I think the short answer to that question is like, it depends. But that's my overarching view on that. So maybe what I'll do is get into some of the kind of teaching material, and then we can kind of address some of those more complexities about treatment later. I do see this diet question. How effective will this be in tamping down impulsivity? Yeah, so the diet thing is very complex. It's a complicated thing to study. We do know that if you use a dietary intervention just in a general group of, say, children with ADHD or people with ADHD, the effect size, meaning the impact on symptoms, is not going to be as large as something like, especially medication treatments when they work, or CBT. There is some limited evidence that something like omega-3 fish oils can have some generic kind of good for you. It's one of those treatments where it's like, might help, probably won't hurt. So, we can consider that. And then there's some interesting information about a smaller subset of people who already show evidence of food sensitivities. And among those people, that might be where diet might have a little bit more of a role. So it's a nuanced question. And I can talk about that at the end of what I said, just wasn't a nice, concise answer. I feel like my fallback is always going to be, it's complicated. Excellent. So let me talk a little bit about some background, and we'll see sort of what of this is useful. I'm not sure why there's a scribble on my screen. Not sure where that came from, but we're just going to try to ignore that. So what is ADHD? How do we define it? So there could be a lot of debate about this, but at least the current conceptualization that rules the school, so to speak, focuses on particular symptoms at a particular frequency occurring across settings of either inattention or hyperactivity impulsivity. Generally, what we see is predominantly two subtypes: the predominantly inattentive only symptoms, and then people who have kind of a combined presentation. Across development, it is categorized as a developmental disorder. And what this means is it's a delay or a difference in the rate at which a particular set of processes or capacities are developing. So in this case, what we're thinking about are this idea of executive functions. So the functions of our prefrontal cortex that are related to dopamine functioning in the prefrontal cortex, things like being able to inhibit something, your kind of immediate response in order to direct your attention towards the future. The ability to plan, the ability to hold information in mind to guide your current behavior. And it's not that kids with ADHD don't have these abilities, or they're not going to, improve these abilities over time, but on average, they're sort of lagging behind other kids in that development. I will share, I'm the mom of a wonderful autistic person, and I see this a lot with my son. It's different abilities, but he's kind of at his own pace, and we're seeing him hit those milestones. It's just kind of behind and in a different way than other kids or my typically developing son. So that's kind of how I think about it. So with something that's really, really important for any what we would call psychological disorder is you don't get there in terms of meeting criteria just based on symptoms. The person who trained me in assessment of ADHD would always talk about, where's the impairment? You want to start with where are you having problems in your life, and try to understand those, and then work backwards and say, is ADHD a good explanation for kind of what's going on here with me? And we do see across research studies that ADHD in adulthood, in somewhat predictable ways, affects all of the ways that adults have to function in the world. So, obviously with kids, you're seeing more school impairment. With adults, it's work impairment. It might be in your interpersonal or romantic relationships. Certainly managing of finances. Driving was a big area where, before the field sort of recognized that adults can have ADHD, then you're sort of like, well, that sort of makes sense in retrospect that, being inattentive and impulsive on the road could be kind of problematic. So that's a thing we see risk as well. So we're sort of looking at, when we're talking about assessment, we're trying to get a good idea. What are the impairments? And of course, getting an idea of the impairments can help us understand like what kind of treatments are going to kind of work best or are going to be most appropriate for folks. So another important thing about ADHD is it is not like being pregnant. You can be a little bit ADHD. It's not like you either are or you aren't. It's not dichotomous. And so that makes kind of diagnosis really tricky because these traits related to executive functioning are kind of normally distributed in the population. They're sort of continuous. And so where to draw that line is difficult. And actually, this is true for a lot of our disorders. Very few mental health conditions have that very you either have it or you don't quality about it. So that's something to understand about ADHD too. The last thing that I will say on this slide that's important is that variability in symptom severity or in impairment also can vary a lot based on the situation, right? So often you'll have parents, I'm going to be stereotypical about this, bringing in a little boy to be diagnosed with ADHD, and they'll be like, well, how can he be inattentive? Because he'll sit in front of the video game for 2 hours without blinking. And it's like, yeah, but that is in a situation that is giving you a lot of reinforcement, a lot of immediate feedback. It's something designed to catch and hold your attention, right? And so we shouldn't be surprised that maybe there's some situations that are harder for adults with ADHD than others. And actually, like, honestly, the way I think about treatment and intervention for adults is thinking about how do you kind of set up your environment when you can to kind of minimize the extent to which it's going to work against your ADHD symptoms. So that situational variability is tough because sometimes I think it makes people sort of doubt the reality of ADHD, but it's exactly what we would expect out of a disorder that's, kind of impacting your ability to pay attention to things in the future as opposed to what's happening right here in the here and now, if that makes sense. When we're doing an assessment, it's so important to consider what are other things that might be going on along with ADHD. And this is tough because we know that things like depression, like if you look at the diagnostic criteria for most psychological disorders, something about distractibility is on that list. So when you're doing what we call differential diagnosis, being really careful about like, is it primary ADHD? And I could say a lot about like how you kind of can tease that apart. Or is something else a better explanation? Now, making it even more complicated, as many of you probably already know, ADHD can come along with other disorders. ADHD can increase the risk for other disorders. So we know that ADHD in childhood increases the risk for things like depression and anxiety. So that teasing apart of it, is it and, or is it either or? And then how does that feed into treatment? So that's important. We know that environmental and lifestyle issues can, make people like temporarily look like they have ADHD. If you're going through a really extremely stressful situation, distractibility, maybe behaving impulsively to try to escape those negative emotions is something that somebody could exhibit. And then of course, things like, a big differential diagnosis is this a sleep disorder? How does sleep kind of play in here? And then finally, it's really important to know that there are certain medical conditions that can contribute to kind of ADHD-like symptoms. So all this to say that like a really good solid assessment can really be helpful in pointing folks in the right direction for treatment. So I'm not going to go through this in too much detail. When I do the college student thing, I spend some time on this because, they're used to being in school and taking history classes and stuff. But I just put this here because one myth about ADHD is that it was like somebody just made it up in the 1980s and like pharmaceutical companies just thought we need to sell some stimulants here. One of my former mentors, ongoing mentor, really, Dr. Russell Barkley, has done a lot of, he's not a historian, but he's done a lot to try to track back where are we seeing this stuff come up in the medical literature. And in fact, as you see here, like 1700s, people are describing things in children that sort of sound ADHD adjacent. And then you see there are just a lot of changes in terminology. I still get a lot of people really identifying with the idea of ADD as like the inattentive and ADHD is like the hyperactive. So even though ADHD is like the technical term, that ADD thing, people seem to really like identify with that label. So just knowing that this is, there's serious, tons of serious research going on around ADHD, and there's a good history there of people working on it. But really evolving, especially for the adults. Another question you get is, okay, was this just something that like, America created, or is it, something that only exists in the US because of our high pressure school systems and, our structured workaholic culture? And I'm going to say probably that stuff doesn't help and probably like exacerbate some of the problems that people with ADHD experience, like culture. If the situation is important, right, we should expect to see cross-cultural variation. But the truth of the matter is that there is some cross-cultural consistency. So in terms of like, just percentages, you can get different numbers here depending on how stringent you are on saying who counts as having ADHD. So there's some variation, but about good solid big study sort of see about 5 to 7% of children getting diagnosed and about 3 to 5% of adults. Again, as I mentioned in response to Wendy's question, there are some adults that, although they might not like meet full criteria, they might still experience like some impairment related to ADHD in childhood. By gender, we see an interesting pattern. This has been validated in a bunch of studies. In children, it's more commonly diagnosed in boys. So kind of the earlier in development you're looking, the more likely you're going to get like a gender skew in terms of like who's meeting the criteria. That could be because the criteria are gendered. It could be something about the developmental trajectory of the disorder in boys versus girls. But what we know is by adulthood, when we look and see who's coming into the clinic saying, hey, I think this is a problem for me, you're getting much more of an even split in terms of who is meeting criteria for ADHD. So often, I think the gender question is sticky. Like there's a lot, I think, out in the popular media, maybe that has, I would say, gotten over its skis a little bit in terms of this idea that, oh, ADHD is totally different in women. And I'm sure, like, I think there are ways that women's experience with ADHD can be very different. But it's just not clear from the research, like how different the symptom profiles are. It's still like an area of ongoing work. But we certainly know, obviously, like it impacts women and that women's roles, all the stuff that comes in with gender, with culture and social roles is going to impact how that plays out for men versus women. And that's important, I think, to recognize.
Laura, we have a question. We have a question that just came in that resonates.
Yeah.
It came to me privately with this slide. And the question is there any way to determine if the percentage of people diagnosed with ADHD has been consistent over history, or it's just no way to tell?
Well, okay. It's such a good question. There are ways to sort of get at it from a research standpoint. And the challenges there are that the criteria we've used have changed over time. Some would argue that, like with the criteria, same with the criteria for autism, we've made the criteria broader. So when you make the criteria broader, you're going to diagnose more people. Does that mean we have an epidemic? Maybe it's changing, but it's hard when those criteria are different. The other piece is awareness, right? Like, how many people know that this is a thing and know that it's a thing that they could self-identify with and seek help for, right? So when you see more people either self-identifying or getting diagnosed, it's hard to know, is that the underlying genetically predisposed trait is changing, or is it that the social, what would we say, sort of the social context and awareness is changing? And then, of course, the other thing is, right, like, we become people that sit at desks and do work versus people that are out in the fields doing work. And again, I don't think that, what I would say is, I don't think there's good evidence that that trait and how it exists in people is changing. I think the extent that it's causing problems for people is changing because of changes in our lifestyles, but also good stuff, right? Like people seeking help and knowing that there are resources that they can access. It's not just, the explanatory model changes. Like I worked on internship with a lot of adults who were not diagnosed until adulthood. And of course, before then, I was just the lazy kid. I was not working up to my potential. I was the underachiever. That was their explanatory model. And that's a very different psychological experience than, oh, there's this thing, there's this way that I'm different that is not, I wouldn't maybe like, I don't love this about myself, but there's ways that I can learn about it and roll with it. And it's a form of, diversity to be accommodated as opposed to like a moral failing, sorry, I'm getting on my soapbox a little bit.
No, I think it's fascinating because I'll just make one comment.
Sure.
I'm 47 years old. And when I was a kid, I remember in middle school, there was one person who had, who talked about their ADHD. And today, my daughter, who is in middle school, she's like, did you know that 10 people in my class have, so it's just maybe more people are talking about it, maybe, and so I appreciate you answering that. Well, the person who asked that question.
And this gets to the sort of thorny issue of overdiagnosis, right? And I think from my reading of the research literature, like people will say, is ADHD overdiagnosed? I'm like, yes. And it's also underdiagnosed, meaning like meaning like my biggest concern is I'm not sure people have access to really good quality assessments that can tease out some of these challenges. And we know that among certain, so my question would be among whom, right? We know that kids in under-resourced settings are probably not getting diagnosed and accommodated and treated in the way that would be good for them. And maybe it's true that in other groups, you know, I don't know. I just don't want to judge anyone's experience, but I think if we're looking from a public health perspective, like it's more nuanced than just, is it overdiagnosed? Do you know what I mean? Like there's a lot that goes into it. Yeah.
Thank you.
Sure. Okay, so causes of ADHD. So as I tell my students in intro psych, the nature nurture debate, it's both. Lecture over, done. No, just kidding. Yeah, so it's both, but with ADHD, it's both in a very particular way that becomes important, I think, to treatment. So when we look at what causes ADHD, if we are talking about those core ADHD symptoms that I talked about, a trait that, you know, varies across people, it's incredibly heritable. So it's as heritable as height is. So if you want to predict your kid's height from your height, that's about the degree to which you can sort of predict kind of this trait from parents to kiddos. We know this from twin studies. We know this from family studies. It's one of the most heritable sort of mental health disorder like traits that we have. And mostly the candidate gene, so it's polygenetic, meaning it's like tiny effects of a whole bunch of different genes. So it makes it hard to study. That's true for most mental health conditions. But the genes that appear to be having the biggest effects affect the processing related to dopamine in that prefrontal cortex. So that whole kind of brain-based stuff that we sort of hangs together. Prefrontal cortex, the functions of the PFC, dopamine, and then the stimulant medications, you know, have kind of their mechanism of action for dopamine and also norepinephrine. But here's the thing. Regardless of the degree to which genetics influences that basic trait of ADHD symptoms, environmental and lifestyle factors can have a huge impact on how much those symptoms get translated into impairment. So I talked about like, what kind of work are you doing? What kind of educational setting are you in? What skills and strategies have you picked up over time to structure your environment in a way that, you know, is more conducive and works kind of with your ADHD rather than against it. And it's definitely not true that like one could perfect one's environment to get rid of ADHD, but it's certainly like a lever you can pull to kind of, what would I say? Just to live a better life, basically, from the environmental perspective. And so some of these environmental factors do include stuff that we know is good for all of us, right? When we're eating healthier, especially when we're sleeping better, when we're managing stress. And then that idea of environmental fit, you know, when I work with college students, having them think broadly about career paths, right? Just because dad was an accountant, is this the best path for you? Maybe if you have ADHD, it might be, I don't know, maybe it's like you're really motivated by accounting, but maybe not, you know, thinking, which is good for all our college students, right? But especially empowering them to say like, I have not just the obligation, like I have the right and the obligation to choose what is going to work best for me, not to limit myself, but to be nice to the me of the future by being like, what is going to be most life enhancing for me in the long run versus what other people expect me to. I'm in advising time right now at U of R. So I'm like, have my advisor hat, my academic life advisor hat on a little bit. So kind of finding your niche there, I think can be important. I think I'm going to roll through this. I kind of sort of covered this, like what are the executive functions? I think I kind of covered all this. So you think about things that are helping you to regulate your behavior now in pursuit of a future goal, especially when there are distractions, is sort of what the EFs are. Yeah, I think that's all I want to say about that. Okay, so we covered this in my little review slide. So genetics and environment are important, but sort of for different reasons. They play different roles here. Which I think, again, kind of connects to that idea of when we look at the treatment strategies, they're playing different roles. They're different. One's a hammer and one's a wrench or something. That's a bad metaphor, but they're different. I think I can roll through this a little bit quickly too. So I think I've sort of made this point already that I think some people coming into this think like, oh, ADHD, that's like so straightforward. It's easy to diagnose. I would argue it's probably one of the hardest of the psychological disorders to diagnose. Again, just because, like I said, this idea of being inattentive just comes up because of so many other kind of not competing, but alternative explanations. And then also that issue of comorbidity. So evidence-based assessment really is designed to get multiple sources of information from multiple reporters using different kinds of tools. You really need a super good history from your client to be able to tease apart, because if this is something that, started 6 months ago out of nowhere, it's probably not ADHD. It's probably something that's not developmental disorder, so probably something related to more kind of like acute onset. But I just share this because when I was in graduate school and working in an all ADHD assessment clinic, we were able to kind of use all of these procedures. And again, one thing that I, in my work, wish for the world is just access to better, in general, psychological assessment, but like specifically for ADHD. So let's see. I think I'm going to skip that. This is one where I think if we were in a smaller group having some live discussion with people who have all been diagnosed, we would talk about this, but maybe reflecting on what your experiences have been. Also, as a person who has done a lot of assessment in my career, it's never too late for assessment. So even if you have been diagnosed and you've been engaged in treatment, if you have the ability to do so at any time in your journey, going for a more in-depth assessment to see where you're at now can be super helpful. Say, like, what have I done so far? What's helped? There are clinicians that can do a great job of saying, like, what's your history been like? Like, let's get a sense of like where you're at. Like, do we need to do some additional digging about some of these alternative explanations? Especially for kids. I mean, development is a moving target. And so periodic reassessment is a good thing if it's something that you can access, which of course is a challenge sometimes. Okay, so I'm going to talk a little bit about treatments now. And although we're focusing on adults, I put this little table up here because it sort of shows across development, like summarizes what do we know about the treatments that have the most kind of like research evidence behind them. So I'm going to talk more about this, but the stimulant medications, and in some cases, some other non-stimulant medications, have sort of the highest level of status in terms of evidence is well established. Now, that doesn't mean they work in every case or they always work or they always have a big effect, but it means we have evidence that they're worth a shot. They're a probably would try, kind of thing for most people, unless they're counterindicated. For kiddos, we see behavioral management, and that could be like classroom management where the teacher is giving more behavioral feedback. Like my kiddo has like a daily report card system that we use to help give him feedback on his behavior. That could be specialized parent training to help parents make use of frequent feedback and a structure, again, structuring that environment for the kids. It's easier for them to follow rules and be successful. These are helpful in kids. The reason they're not as applicable in college students or adults is that there's not really parents or teachers there to be the behavior manager, right? And to control the consequences as much. So that's where we move down the table here to these skills training interventions, which I would say cognitive behavioral therapy for adults with ADHD is, where now you're helping the adult to, again, structure their environment, learn skills that are just going to be tried and true to keep themselves on track. And then, maybe use some of these behavioral management tools like with sort of a self-management, which of course is like really challenging. And that's the challenge of this type of, it's like one of my clients like, well, how do I remember to take the medication that helps me remember to take my medication? Like that's kind of somewhat of the challenge you're in when you're doing this work with folks. And it does really take, my take on it is like, what that means is then I have to really partner as a good coach so that I can guide my client through like trying out different systems, figuring out what's going to work and what's not, and kind of practicing until it becomes like, okay, this is second nature. I don't need to think about using this Google Calendar anymore, like whatever that thing is. So it's definitely not easy, but we know from the research it can be done. So again, with the medication, I actually that conversation article that I put the link in the chat has a nice kind of like very pithy like overview of what we know about the medications. Just to be brief, they sort of fall into two categories. The stimulant medications, there are some common names there many of you might recognize. The big thing about stimulants is they're very short, unless you have some sort of specialized formulation, they're very short acting. And so a big piece of drug development for the stimulants is formulating things like Adderall XR or Vyvanse or Concerta, things that can prolong the action of the stimulant so that, unlike my friend in first grade, you know, you're not having to go to the nurse after 4 hours and get another dose of stimulant. So same molecules, but prolonging the length of action is like a really important problem with those medications to solve. Non-stimulants, there's probably new ones on here that I should put on here, but these are atomoxetine or Strattera and Wellbutrin, which is also has indications for depression treatment, are kind of the most common non-stimulants. You'll see a lot of adults who have comorbid depression and ADHD have Wellbutrin as a thing that the clinician will try, just because that can be helpful for both things. They're among, although they don't work for everyone, they have their drawbacks. They're among kind of the most kind of successful when they work psychiatric medications that we have. A lot of kids do respond to them. Of course, they do have side effects that I'll talk about in a moment. Adult response to stimulants, still good evidence, but the response can be less consistent. If somebody has cardiac problems, they can be counterindicated. And then, of course, because, you don't have a parent or somebody managing the medication, that medication adherence can be a challenge for adults with ADHD sometimes. Side effects that are important to know, these are the most frequent ones. So sleeping problems. So for example, that's another advantage of these long-acting medications. If you take it in the morning, then you don't have to take an evening dose and you're still kind of hepped up when it's time to go to sleep. So that's something you want to be careful about. Of course, decreased appetite and weight loss, which like some people are like, is that a side effect? Yeah. But the ones you have to be more worried about are increased blood pressure and heart rate if somebody has like counterindication with a cardiac problem. And then some of these more unpleasant things that might make somebody discontinue the medication. It's important to know that, like, rule of thumb when you start taking the medication is when you're probably going to get the most side effects because, your body's kind of getting used to having it on board. And it could be related to dose. So sometimes clinicians might try like a smaller dose before they switch to, or they'll do that thing where they start low and go slow. The other thing about medications is having a really good treatment relationship with your provider, because we don't have any way of knowing who's going to respond to what medication before we try it. And so this idea here on the slide of a positive medication response. So the idea that you're getting an effect on symptoms and you're not experiencing intolerable side effects. The challenge there is, like I said, it in a lot of cases, for some people you get it right on the first try. Others, like, it's going to take really good communication with the clinician, ability to try new things. There are times, right, that something might stop working and you have to, so that finding a good prescriber is hard to do, but it's so important. And I think sometimes us on the therapist side of things think like, oh, medication prescription, you just like write a script. No, it's challenging, and the interpersonal connection you have with your client, or patient, is really important there. As far as safety and effectiveness, it's a lot about taking things as prescribed. If you're supervised, if you're taking your pill, you're not crunching things up and snorting that, taking them in ways that they should not be taken. The safety profile is quite good. So just an encouragement too for people, if you have been on medication, kind of like with you can always enter into the assessment process. Like, you can always enter into the renegotiating your medications journey with your clinician at any time if you feel like you need something different or need to tweak that tool in your toolbox. Okay, this is our little discussion. Okay, this is kind of good time. So I'm going to talk a little bit about, I'm going to skip this a little bit. Cognitive behavioral therapy for adult ADHD. Yay, that's like my bag. That's what I do. So this slide is really just to say that you may have heard of the term cognitive behavioral therapy, or CBT. And CBT is kind of very large family of interventions that are based on the assumption that the way you think and the way impacts the way you feel, impacts the way you act, and, you know, interacting with all these things, interacting with themselves. And that there are ways that we can intervene with each of those, you know, pieces of the cycle in order to help people live better lives. That's like the overarching philosophy. Also, that we can study these things scientifically and use that to figure out what works. Those are kind of like some big overarching like CBT philosophy things, although there's some more. So just know that if you've heard of CBT, there's different CBTs for anxiety disorders that look different from CBTs for depression, that look different from CBTs for bipolar. And so the ADHD CBT is going to have some overlap, but it's going to look different because people with ADHD are coming with kind of different things they're working on. This is one at the end I can put in the chat. This website, I love it. It's from APA Division 12, which is the clinical psychology division of the American Psychological Association. And they have a whole website that gives you a rundown of like, what are all the evidence-based treatments for like all the different difficulties people have. So it's kind of like a one-stop informational shop there. All right, so to talk a little bit about CBT for adult ADHD, maybe just to wrap up here, and then part of the Q&A, I can talk a little bit more about like, well, what are the strategies that, you know, what does it look like and what are tips and tricks and stuff. So this is a graphic I created for a treatment manual and workbook for college students, actually, that sort of shows like, okay, well, what are we trying to do in CBT, and why would we use CBT or any therapy? Why not just like, how does it differ from the role of medication? So looking at this graphic here on the left, I think about medication as sort of, I don't have it on the chart here, but kind of intervening at the level of the ADHD symptoms, right? What's happening in the brain. And I think about medications as being something that works from the outside in. You know, it's not going to get rid of the symptoms permanently. It's going to turn down the volume on those symptoms, and, you know, enhance those executive functioning abilities like on a temporary basis so that you can engage in the world and do what you need to do. And a little bit differently, I look at the CBT as being skills people learn that's going to also help to break that link between ADHD symptoms and impairment or the problems in your life. And then are going to help to address some of the psychological consequences of living with ADHD. And what I mean by this is the ways that living with ADHD may have impacted the beliefs you have about yourself, the beliefs you have about your ability to even manage ADHD. You know, have you developed, you know, this idea of like, it's something that I just can't change, or okay, I make a mistake, I'm late for something. Okay, that's another example of how I'm just going to be the late person for the rest of my life, and why should I even try? You know, these ways that the struggle has impacted the way we think about ourselves and the world and our motivation. So we sort of have some skills to just help manage symptoms and help get stuff done. And then we have some skills to look inward and say like, okay, in that moment when I have that thought, is there a different way I could coach myself to engage in more of an active response, to keep myself motivated so I can, and then I'm, you know, something I've been thinking about a lot lately is like, this should never come off as like, the point is that you just need to be like a productive employee all the time or like get A's all the time. This isn't about productivity. It's about like, what do you as the person with ADHD want in your life, right? And how is ADHD getting in the way? And as a clinician, really focusing on the work of like, yeah, what are your goals? What do you want to get out of it? This isn't for somebody else, you know, so that your boss can get 60 hours of work out of you. Like what is meaningful to you? And we're going to shape the treatment around, you know, what do you want to get out of it? I think that's really important. So I have here a list, and there's actually a lot of different sort of flavors of CBT for adult ADHD. Most of them include kind of what we're doing today, which is just learning more about what is ADHD, how does it impact people. Most CBTs include some type of organization and time management skills. Steve Safran, who I trained with, who developed one of the first CBTs for adult ADHD, used to say, the strategies we work on are not like rockets. Like we're not inventing a whole new organizational system. It's taking kind of very straightforward sort of calendar task list systems and ideas and working to get the right system that is usable, that's not too complicated, that you can really implement consistently, and helping to get to that point of consistency. And then, as I talked about earlier, self-motivation, how to structure your tasks in a way that try to reduce procrastination, essentially. And then, like I said, some of those skills to say, okay, in those moments when I'm, not engaging, or I'm not feeling motivated, or maybe on the not so negative side, like, oh, I have plenty of time to do that later, or oh, I do better waiting till the last minute. Like, what are ways we're coaching ourselves either more too negatively or too positively that might not kind of get us where we want to go? And that's hard. Like, recognizing your own thinking takes practice. And so that's a lot of like what you do in CBT is like, can you become more aware of those moments, and can you think ahead about in those moments, well, let me engage with this strategy rather than avoiding or doing, what I automatically like go on autopilot, which we all do. And then sometimes these approaches include distractibility reduction, like sort of structuring your environment to reduce distractibility. Mindfulness has been shown to be useful. Emotion regulation that you might see in, if anyone's familiar with dialectical behavior therapy. But yeah, so that's kind of the general flavor of it. It's very much like an empirical approach, like working with your therapist to like try stuff and see what works. I do want to say, to the point about diet, all of this stuff, even if it doesn't cause ADHD, can certainly impact the extent to which ADHD impacts life. And we also know that from research, adults with ADHD have more trouble with some of this lifestyle stuff because it involves self-regulation, right? Like, it's, again, like, the kind of adulting stuff that is made difficult by ADHD does impact stuff like eating and sleeping and exercise and all that stuff. My big thing for people is start small. Like, I'll talk to clients and I'll be like, what's your goal? And they're like, I'm going to work out every day this week. I'm like, let's back that up a little bit. Like, what if you did it once? If last week was 0, like, good. That's progress. Yeah. So I think I'm going to stop there because I know we're running up on time. I appreciate your willingness to let me a little bit like improvise here with this new format for me. I'm just going to put up, as we answer a couple of questions. This is something that I'm like really thinking about a lot because I'm actually working on a book that is going to be very focused on like targeted sort of tips and tricks for challenges that adults with ADHD have, but then at the end going to have some of these like principles for thriving. So these are just ideas I have been kicking around lately. And I don't have to talk about them, but I thought I'd put them up there if anything that I write there seems interesting. But yeah, I guess I'll just take questions if that's okay.
Yes, thank you so much. First off, I want to sign up for your class. I wish I had you as a professor because you not only are you smart, you have passion, and I see that. So thank you.
Thank you.
So we do have a couple questions. Some came on the big chat, some came in privately. So one question is about assessments. Do you have any suggestions on how to find a reputable place? What are you looking for to do an assessment?
Yeah. So, oh my gosh, if I could solve this problem. So in my community, and this is based on just my clinical, this isn't based on like research or anything, but I think a lot of times these folks, if there are times when families need to seek out what's called a psychoeducational assessment for kids, like with IQ and achievement testing, say for school placements or things like that, they might seek that out. You're going to want to look for somebody that says they do psychological or psychoeducational assessment, like specifically in the list of things they do. Okay. These tend to be clinical psychologists with PhD. So that's the kind of like training you're sort of looking for. Clinical or counseling psychologists with PhDs are the ones that get like more of the assessment training in addition to the therapy training. Another keyword you might look for is somebody who's a practicing neuropsychologist. That's another key. I can put that in the chat. That's another key like code word for somebody who would have this kind of training. Neuropsychologists almost exclusively do assessment, and they would be trained to do this. Yeah, I wish I had a better, I mean, you can look, I should know this off the top of my head. I know Chad has provider listings. So looking at that resource, I'm sure they're probably tagged with like who does assessment.
Okay.
And people actually can feel free to, I might be opening up the floodgates, but I'm willing. Can email me, and like it's kind of like you sometimes who in a particular metro area, like, oh, that clinic is like, I hate that it's word of mouth like that, but if anyone, I'm happy to put my email in the chat. And I can let you know who, like in my social network, I know like in your metro area that might be good. And I'm sad that it comes to that kind of informal channels, but yeah, that's my answer to that.
No, thank you. And thank you for sharing your information. What I want to do and let everyone know is we do have a couple more questions, but I like to be sensitive to everyone's time. So since we're so close to the end, I'm just going to end with some announcements and make our formal closing. And those who want to hang around for a few more minutes, I'm going to get in the last couple of questions that came in. I call it our virtual lobby and hangout. So that's what we will do. So I want to, Dr. Knouse, thank you so much. And to Chad for being our partners on this program. This program is recorded and will be on the No Shame on You YouTube channel in the coming days. Please feel free to share it with anyone that you think might be interested. Everyone will get a recording, those who could not make it today and signed up. We really had a robust attendance for today. If you can take a moment to fill out the Google form that I just put in the chat, just to make sure that we're hitting the mark, that we can report back to our generous funders who make our programming free and possible. We would be grateful, and look forward to our next Feed Your Mind series next month. It is going to be on the topic of mental health and social emotional learning for infants and toddlers, because next month is a National Early Childhood Month. And this month, I forgot to mention, is National ADHD Awareness Month. And that's why we chose that for this month. We will send you an email if you don't have time to get through the chat and click everything. I will take all this information and share it with a follow-up email with the recording. So thank you for your time. We're going to see you all again in the future. And that's the formal end of this program. Okay, so we had a couple of other questions. One question that came in on the private chat: is there anything like cutting edge that is coming down the pike that you're excited about?
Yes. Oh my gosh, so much. So one thing that I mentioned, my work with Inflow, the app development company. I mean, for any cognitive behavioral therapy, this is really exciting, because a lot of what you're trying to do is to get people to learn new behaviors and be aware of their thoughts in the moment and all this stuff. And so the idea that like an app can be more there in the moment than the therapist can is like a really exciting development. So with that, there are definitely different teams that are working on that. I got the opportunity to work with them to do a short kind of pilot trial just over 7 weeks and see when people used it, did they like it, and did they tend to report a reduction in ADHD symptoms, which they did. But right now, I teach at an undergraduate focused institution, so I have grad students to do a big study, but I help them partner with colleagues at Syracuse, and they're running like a bigger study with a control group to like see if that works. So digital health stuff is definitely like a big thing that I'm excited about.
Amazing.
I mean, something I'm excited about that I am doing in my own work. I mentioned the sort of negative thinking that can reduce people's motivation. And that's been a standard part of CBT since CBT started. What I'm interested in is exploring more some of these not so negative, but maybe overly positive thoughts that all of us engage in, like, oh, I can do that later, or I don't know. And my lab right now is working on like measuring those and understanding how those can contribute to procrastination. And maybe that's a point where if you can recognize when you're having that thought, you can be like, let me be real with myself right now. Yeah,
that's interesting. That's a different, that's a different take on it. Yep. So I appreciate that research and you're thinking about it. So this question came in: what are common mental health issues that are often mistaken for ADHD, and which symptoms are most exclusively related to ADHD?
Oh, what a great question. So my instinct is to try to Google Scholar that that really good research question and see if there's a specific paper that talks about that. But I will say from my clinical experience, it's going to be those disorders that are the most prevalent in the population. So for example, anxiety disorders. A third of people will be diagnosed with an anxiety disorder at some point in their life. So for differential diagnosis, I would be looking at something like generalized anxiety disorder where it's sort of chronic and that worry is feeding into the distractibility and that sort of thing. Obsessive compulsive kinds of processes. Certainly, if you're having a lot of obsessions and intrusive thoughts, you're going to look pretty distractible, I think. I think the mood disorder, so depression, of course, concentration difficulties are a part of depression. Bipolar disorder. So I would say those are the main ones. I think you do as a clinician have to look out for things like you want to ask about substance abuse. How is this a person who's like using a lot of alcohol or other drugs? And we do know that from some of the research that there's some ways that chronic substance abuse can look like ADHD, but then of course ADHD can put you at risk for that stuff. So it's complicated. And the second part of the question was what symptoms are sort of more exclusive to ADHD? I'm going to answer that by saying I'm not sure it's a matter of which symptoms are exclusive, but when you're trying to do the differential diagnosis, you really want to look at developmental history. Like when did these problems start to occur and how chronic have they been? Something like a bipolar disorder will have more of a waxing and waning kind of pattern to it. And it will generally have, well, not always, but may have more of an acute, like an onset that happens like over a shorter period of time. Whereas with ADHD, you're looking at something that is like, this has kind of always been, maybe it hasn't been as bad, but this is kind of how I've always been, as opposed to like, I used to not be depressed and now I'm depressed. So a lot of it is about getting a really good clinical history. But yeah, that's a great question. I want to Google Scholar whether anybody's looked at which of the specific symptoms are most diagnostic of ADHD versus other disorders.
It's so hard. It's all, you're right. It's so interwoven.
Yeah.
So this question came in earlier and I was trying to see if I could erase the line on your slide. So my tendency to lose focus for that moment. I don't know if you answered.
What is this weird line? And now it's gone.
I have no idea. But anyway, this came in, so I don't know if you answered it while I was focusing on that. It said, can symptoms change with age around puberty and physical maturity?
Oh, this is such an interesting, I'm sorry, I feel like my answer to every question is, it's so interesting. No, this is an evolving area of research specifically around women and hormonal changes and how that feeds into the expression of ADHD symptoms. There are some clues there that there can be symptom exacerbation. I'm not sure about adolescence, but definitely there's some work around like menopause and those changes. So I think there are clues there that there can be changes when hormones are shifting around in the ways that, we know those things can have effects on mood and anxiety and that sort of thing. Maybe a broader point, though, would be that in general, what we see across development is that, and this isn't true for everyone, but in general, you see the motor hyperactivity symptoms decreasing in their severity, but the inattentive symptoms may be tending to continue. So I think that's what contributed historically to maybe thinking that most people grew out of ADHD because they don't look hyperactive anymore necessarily, but they're still, those inattentive symptoms are the ones that, if they're going to persist, are more likely to persist than hyperactive.
Thank you.
Yeah.
Well, that is it for questions. If anyone has anything who's still, on here and wants to unmute and say hello or whatnot. And if not, just thank you. This was really interesting and I appreciate the resources and the work that you're doing and the difference you make in the world. And
thank you.
We hope people who need the help will seek it and will get the help that they need. So thank you.
Awesome. Thank you.
All right. Take care, everyone. We'll see you soon.
Thank you.